It is Thursday, August 20th. Joe Delaronio Juts. Welcome to our COVID-19 task force update in what has been an emotional week. We have all been through this together as the Grand Chief is now off to the spirit world. In the meantime, there is still work to do. And some of that includes keeping everyone updated on how things are going here in Kahnawake and beyond regarding COVID-19. As we've said many times, we have been fortunate here in Kahnawake. I don't think it's been luck. I think it's a lot of work by people within the task force, people in the services, but more than anything, you people, we the people, have been working together to ensure that we wash our hands and take care of social distancing and all of that. We only have one guest on the program today, and of course the Commissioner of Public Safety is here just about every day of the week. Let's welcome him in, Lloyd Phillips.
Thank you, Joe. Yeah, it's certainly been a very trying week here in the community and as well as at the task force. As we all know, the Grand Chief was laid to rest yesterday, and once again, condolences to his family, friends, and loved ones. And it certainly impacted the entire community in one way or another. But as Joe Delaronio just mentioned, I mean, there are certain things that must maintain. We must do what we have to do to address the ongoing issues regarding the pandemic, as we have been doing since actually very early on in March. And obviously moving forward, we'll continue to do what needs to be done to maintain the safety of our community to the best we possibly can. As was mentioned, we always watch what's happening around the world. And what's happening, in the U.S., even more closely, because obviously we know our community is very closely connected to the U.S. So what happens down there is definitely worth watching and paying attention to, because things down south could, easily, impact our community in one way or another. So we always keep watch on that. But more specifically, we watch what's happening in the province of Quebec and also in the Montreal area. So, looking at that, especially looking at Quebec and the Montreal area, we have seen some very positive signs. The numbers of new cases have continued to drop. There was a spike several weeks back, after some of the bars opened in the Montreal area and the South Shore. There was a spike in cases, but since then, it has leveled off. We've been seeing anywhere, between 60 to 80 new cases per day throughout the entire province of Quebec. Again, which is very good numbers, which is honestly probably as low as they're going to get, over a period of time. So. We are in a low point of the pandemic, but as we said several times before, we certainly cannot forget that the virus is still around us. And more and more we maintain our key pillars of hand sanitizing, clean your hands, masks, and physical distancing. We can help minimize any transmission of the virus. This is also obviously more important because obviously we're looking to the continued evolution of business reopening in the community. Obviously schools reopening in the community is some area that we're working on. A lot of work happening in that area, all evolved around safety. And Robin Delaronio and her staff have been working many hours in conjunction with Dr. Goche, working along with myself and the task force. So it's a collaborative effort, and I know with my hats off to the KEC staff that are doing a tremendous amount of work, and more information will be forthcoming on that. But with that said, closely related to schools is the busing. There has been a safety plan that has been validated, for the proper transportation of the children to and from school. That has been validated, and now that is in the hands of the the Public Works Department through Spencer McCumber, who is the oversees the he's the manager of the buses. So details on how the schedule will be working, and which schools are to be going to, and times of buses and that nature. That's the stuff that's at the operational level. That's not a task force issue. Our role was basically to see the plan, validate the plan from a safety perspective, and then again operationally that goes back down to the respective authority. In this case, it does fall with the Public Works and along with the Spencer and the bus depot. So again, safety being paramount, and there's a lot of work being done on that. And it was collaborative efforts. First stab done on safety measures was done by Spencer, and it went through its many veterans, so to speak, and it's now finalized. So things are progressing, things are moving in the right direction. We also received information from all the key organizations in the community on some of the challenges that they had faced, and some of the recommendations and challenges they had because of the pandemic. So we received those. That's going to be reviewed in more detail in the coming days, and we will, like I said before, we will be formulating a report on I guess how the task force dealt with issues in the community. So what were some of our challenges overall, and also what would we do differently if we had to do it all over again. So kind of creating that playbook as we've been talking about, because there is going to be much more planning. As I said before, and I think it's worth repeating, we have to look at the various scenarios moving forward. We hope numbers are to remain low. We hope things are to remain stable for the long haul. But there are some predictions that obviously we talked about the second wave of the virus come later in the fall, all a possibility. So we have to have plans available, plans ready to go in the event we need to take measures to further protect our community. Again, those are, I think I'll have to repeat myself, because those are plans that we want to have on hand, but hopefully, we will never have to use those plans. Also, we want to look forward to putting some ideas to the community and to the council on how we want to remove ourselves from the state of emergency. As you know, it has been extended up until September 21st. We're trying to keep that date as a goal to remove the state of emergency from the community. Obviously, many factors involved there in terms of numbers, in terms of where we are, in terms of the medical and the health side, but also how do we transition out of a state of emergency back into a more normal state, and what is the role of the public safety commissioner in my role, public safety in general in the community, what's the role of the task force and public safety commission. Those things have to be looked at in much more detail once we end the formal state of emergency. So a lot of work happened along those lines, because certainly we can't just end something and then expect a new normal to kick in. There has to be a transitionary measure. There has to be continued monitoring. There has to be certain measures that will remain in place for the foreseeable future. So we're going to be closing those gaps. We're going to be making those linkages much stronger. We'll keep the community up to date as we move forward, because again, no matter who you speak to, no matter we talk about a second wave, whether that be a small wave or a larger wave, and we're going to be in this type of scenario around COVID, and we have to find a way to live with the COVID virus for the next year. If you plan for a year and it's less, great. There's mixed reviews out there when a vaccine may become available, but even if a vaccine is made available and it is approved, the time for it to roll out, be mass produced, and start giving the vaccination to a large amount of people, that takes time. So until that time is there, obviously the vaccine at this point is what we talked about before: social distancing, masking, and hand hygiene as much as humanly possible. That is the cure. That is the thing at this point in time. Until we have that full vaccine, that's what we have to maintain doing. So in that context, we're planning to have those, how do we have the new normal, as we've been saying. How do we have schools done? How do we have business operate? How do we conduct ourselves on a personal level? Knowing that the virus is still around us, but also knowing that, being in a holistic approach, we need to have a certain amount of interactions. We need to have the mental health. We need to have the education. We need to have many things involved to ensure people are as healthy as they possibly can be, and not just physically, but emotionally, mentally, and spiritually as well. Things to consider, many things that we need to look at, and the ongoing planning is taking place. I keep repeating that to the community because there is a heck of a lot of work happening behind the scenes, and we will be informing community as things become available. And I can't underscore the fact that safety, security, and well-being of our community is obviously first and foremost. It's been several weeks, that we have had a positive case in the community. Every test we have back as we speak today is negative. There are no active cases in the community, and we're going to do our darndest to make sure it stays that way and keep our community safe. So with that said, I'll see you again soon. Kahnawake.
Lloyd, and as Lloyd mentioned, no positive outcomes in the last little while. By the way, the testing center is still open over at the Kahnawake Memorial Hospital Center. It hasn't been that busy in the last couple of weeks. There have been 2 or 3 a day, but of course there was that spike when the news came out that when the bars opened, that there was a spike in the number of cases in Montreal. So again, we will stay on top of it as much as we can. We will be back next Tuesday with our next report, unless something major happens, which hopefully does not. So we wish everyone a very safe weekend. In the meantime, remember, wash your hands, social distancing, and wear a mask. Kahnawake.